I'm trying very hard not to gesture at my breasts.
Yes.
I'm not going to do it.
I will.
Okay. Hello and welcome back to DocTalk, my favorite show where I talk to a doc about all of the things I know you want to talk to a doc about. With me, as always, my left-hand woman. Fun fact, we're both left-handed. Dr. Janet Choi, Progyny's Chief Medical Officer. I am Lissa Kline. I'm very excited to talk about today's topic. August is Breastfeeding Awareness Month. We know that breastfeeding, sometimes called chest feeding, is described as like the natural option, but it doesn't always come
Nope, absolutely not.
naturally or easily to everyone. It can involve a learning curve, both for the birthing parent and baby. It can involve challenges, discomfort, concerns about milk supply, pumping, mastitis, as well as sort of when and how to find support around this.
Yep.
So we're going to jump in and talk about all things breastfeeding, chest feeding.
All
You
right.
ready?
I'm ready. Let's go.
We also would like to say, too, as we get started, that we know that not everyone who births a baby is able to breastfeed or chest feed. We know it's
Or
not.
wants to, and
or
that
wants
is
to.
also totally
Yes.
okay.
Totally okay. A fed baby is best, so whether you are using formula or whether you are breastfeeding or
a combination.
All good, right?
Yes.
Yeah. But for those who do want to and are able to breastfeed or chest feed, we're going to help break down some of the questions.
Sounds good.
What actually happens, Dr. Choi, in the body when someone starts to produce milk?
With the hormonal changes of pregnancy in a woman's or person's body when they're gestating, you have increases in estrogen, progesterone, and a hormone that's really important for breastfeeding purposes from the brain called prolactin, right? We're used to talking about prolactin as part of the infertility evaluation, but here prolactin is a necessary hormone put out by the brain. So those hormones increase. And as the prolactin levels rise, they help, along with the estrogen, kind of, evolve your breast tissue and start kind of getting your breast ready to secrete and make milk. Interestingly enough, fun fact, I didn't realize this, is that the progesterone really inhibits the milk letdown. So when you actually deliver and your progesterone levels drop, that's actually a signal to your body to let the prolactin just go wild and crazy.
Yeah.
Not really, but to help you with the milk production and milk letdown.
Hormones are fascinating.
They are.
I see why you majored in them.
Yeah, I actually can envision sort of like a beautiful mind right now, cholesterol all the way down to testosterone and estradiol, but that's for another day in a program. The other physiologic changes that people might encounter as they have and experience all these hormonal changes, in addition to actually having a fetus growing inside you, is breast swelling, breast tenderness, engorgement, as well as milk starts to collect and get ready to be let down. All pretty normal symptoms and signs.
Good to know. So what are the health benefits of breastfeeding for babies and for birthing parents?
Right, so a lot, and just to name a few, so the American Pediatric Association really strongly endorses and supports breast chest feeding through the first year of life of the newborn, because there are lots of benefits, including immune protection for the newborn. There are decreased rates of a myriad of medical conditions, including ear infections, bowel things, improvements in development as well for the newborn with breastfed milk.
And for the parent, there's the happy hormones, oxytocin gets released.
Exactly.
There's some bonding things
There
happening.
typically helps promote bonding.
Yep.
And it also might help for people who are worried about the weight gain they encounter during pregnancy, also helps sort of with the metabolism there as well. Again, a whole slew of other protections. It can, if you breastfeed continuously and regularly, like every couple of hours, actually can help suppress ovulation initially, although I would not rely upon that as the sole contraceptive method for people who've just delivered a baby. And it also helps with uterine contractions post-delivery, so you don't keep on bleeding, so the uterine muscles actually contract down. So a lot of benefits to breast and chest feeding. And with that said, want to keep on restating, if you find or discover or recognize that breastfeeding, chest feeding is not the mechanism of feeding that you want to do for a variety of different reasons, that is also totally okay.
Yep.
I think there's a lot of parental guilt and people being told this is what you should be doing, and the answer is not necessarily.
Yep, agreed. So lots of benefits, and it's a choice. It's an option.
It is.
And for some people, it's not an option,
Right.
of course. So current recommendations say the first 6 months it's important to, when we say breastfeed, that also, I assume, means pumping and feeding from a bottle. It doesn't mean...
Not necessarily having newborn,
Yeah. I'm
suckling
trying very
continuously.
hard not to gesture at my breasts.
Yes.
Very hard. I'm not going to do
I will.
Okay. Okay, so the first 6 months, if this is a choice you're making, the first 6 months are really important for breastfeeding.
Exactly.
What should parents expect the first few days after birth, as far as breastfeeding, chest feeding goes?
Sometimes it doesn't happen smoothly, and if it does, do not worry. You are not alone. You're in the majority, and they're typically in the hospitals, lactation consultants, nurses. You should ask them for their advice. There are trained professionals there to assist you, as opposed to just your family members who are trying to be helpful, but sometimes, oftentimes not. I can speak from personal experience.
And if you have access to Progyny, the Progyny's maternity program, you also have access through that program to feeding support, including IBCLCs, so lactation specialists, 24/7 by phone, and they can also offer pro tips.
Yeah, and also virtual consults with them.
Yeah.
Our virtual doulas as well. A lot of them are able to provide lactation and feeding advice.
Yes.
And we actually have some on-staff PCAs who can assist with that too.
Yeah.
Right? So a lot of resources, but you should please take advantage of.
And so in the first few days, people may see small amounts of colostrum. What is colostrum?
Great question. Colostrum is the initial milk supply being released from the breast tissue from the nipples. And it's typically the first amount of milk that comes from the breast in the first 2 to 3 days post-delivery. A little bit different in makeup than the typical breast milk that's dispensed, that's put out later on and continuously should someone continue to breast and chest feed. It's a little more protein dense, I believe, and it also has a lot more immune substances, so really essential to try to feed that colostrum to your newborn, if this is your choice to do, because it's been associated with improved newborn health as well, decreased rates of infection, other really important factors there.
Love that. What does an effective latch look like? That's something that in the first few days, especially the first, I would say, day, is really important. Do you have anything about that?
So this is where I would actually say let's call on the nurse and lactation consultant.
Yeah.
Basically, you want to, and this, remember, babies don't come with instructions. Feeding don't come with instructions, so you need to ask for advice and support if you find that the newborn is not latching onto your nipple, and if they're fussing, not able to, if they're just continuously rooting around, again, turn to your nurse team. They're eager and ready to help you out and give you advice.
Yeah, in the hospital, within the first hours and days after birth, you have lots of experts around you, so I love that idea. Oftentimes, I think feeding support or lactation support people are automatically going to labor and delivery rooms.
And so they are available, and at the same time want to share the other side of the coin, which is equally important to recognize, that should you decide that this is not for you for a variety of different reasons, it is totally okay to tell those people to leave you alone.
Yes. Please leave. How can parents tell in the days, weeks, months after birth that baby is getting enough to eat? Breastfeeding.
So you want to make sure, and again, your nurse team, if you also are taking advantage of our doula services, lactation consultants, they can give you some very concrete tips in terms of how to track. You want to see the frequency of wet diapers. You also want to see, as you visit with your pediatrician with your newborn, and also before they even get released from the hospital, what the weight drop and weight gain is. It's not unusual for a newborn to lose a little bit of weight initially after birth, so don't panic. But ideally, if they are ingesting enough, whether it's formula or breast milk, chest milk, you should be seeing eventual weight gain as well.
Yeah.
Right?
So you look for swallowing. That's one thing as they're breastfeeding. Dirty diapers, wet diapers, weight, they may lose some weight, but then they're gaining weight back. And so those are all signs that baby is gaining weight. And there is some data, this isn't one of our questions, so if you don't know the answer, that's okay. I believe there is some data that shows that breastfeeding does help with readmission rates, so that when baby's getting enough food and it's breastfeeding, you often don't see babies get readmitted for for losing weight.
Exactly,
Is that true?
one of many things.
Yeah.
And again, with that immune protectant
Yeah.
mechanism as
Yeah.
well, decreased rates of all sorts of infections in the newborn.
Mm-hmm.
So another good reason, if you're sort of toying with the idea of should I be breastfeeding, there's some good medical clinical reason to support that.
Yep. For our same-sex male couples, oftentimes what I see, not oftentimes, sometimes what I see, again, formula is fine here, but sometimes male couples or single males will have an arrangement with the gestational carrier to pump milk for the baby in the first weeks or months post-birth. So for same-sex males, single males who are building their families, that's potentially an option.
That's great, and actually if they have our services, that also includes lactation shipping, milk shipping as well.
Exactly,
right?
milk shipping. What are some of the most common breastfeeding challenges?
Engorgement, trying to sleep, because ideally in the first few months of life you want to be feeding pretty regularly every few hours. And I know, just speaking from personal experience, thanks Jack and Charlie, I felt like it was constant being awake and breastfeeding. But you get breast engorgement if you go for more than your allotted time, where the breasts just feel actually really taut, full, and actually sore and painful. You want to look for signs of mastitis, where there's red streaking under the skin, like extreme pain, not just sort of milk soreness.
And mastitis is like an infection of the milk ducts.
Which is treatable, and you can actually get treated and continue to breastfeed or chest feed if that's your choice, but that you really need to be seeing a doctor for. Right?
So some brief initial tenderness is normal.
Right.
If it is ongoing and severe, and there are those red streaks, that would be a reason to see a provider.
Exactly, and also I think, because too often, especially after giving birth, birthing parents kind of neglect their own needs. I would say you need to be in your best state of mind and best health, and so I would not push off any concerns. Make sure you reach out to, if you have a Progyny care advocate, run it by them. We are not delivering care, but we have a team of labor room nurses who have a lot of experience and sort of coach you as to what signs to look out for and when to call your doctor. If you have a lactation consultant, you want to run it by them as well.
Yeah, and PCAs and the nurses in the hospital also can give you tips on things like there are creams and salves and ointments for cracked nipples,
because
soreness.
that's incredibly painful. I've had situations before where patients have, because they've been chest feeding properly, but the nipples get really dry and sore. So there are balms and salves specific to those who are actually safe for the baby and helps with the dryness and the pain.
What should I like this topic, and this topic is one that our maternity program focuses on quite a bit, which is returning to work. So if you are breastfeeding, chest feeding, and you are returning to work after whatever allotted time you've had, 3-4 months, depending on your leave, what should someone know about pumping and storing milk and continuing, if that is their choice, to feed baby breast milk after they've returned?
So actually, to start off with, if you are planning on going back to work, don't make these sort of schedule changes and choices ideally the day before you go back to work. You want to start planning a couple months in advance or a month or two. Remember, with many of your employers, they check with them. They may actually offer access to a free breast pump.
I think most do, and I think in many states it's a requirement. So Progyny employees have access. We have several floors in our building. Each floor has a room. It's lovely. There are industrial, sometimes breast pumps available. You bring your own attachments. There are refrigerators to store milk.
Which is great.
Yeah, they make it a really lovely space for people who are pumping.
And for those of you who have the time and the wherewithal, you might want to actually start practicing, not even practicing, but starting to work with a breast pump as part of your schedule. And also talk to your, the pediatrician about how to start spacing apart some of the feeding so you're not engorged every 2 hours, right?
And to start months in advance teaching baby how to drink from a bottle, because if they've exclusively breastfed,
very sharp. Good point.
You don't want to be the night before you're going to work and baby screaming and
and then a lot of women and birthing parents what they'll do is when they are breast and chest feeding, they'll also start to preserve some of the breast milk that they've been pumping in the freezer for their work trips and everything like that. Also talk to HR about accommodations. Most places actually have rooms that are private, so you can actually take time off during your work day to pump.
Yeah.
Right.
So we have a couple minutes left. couple questions left, I think. One, I think is really important. Can someone breastfeed while they're taking medications?
Depends on the medications. Obviously, if they're essential medications that your doctor has decided that you really need to stay on, like an SSRI for depression or a variety of other medications, oftentimes they are actually okay to continue while breastfeeding. Do not stop them cold turkey, because again, back to parental health is vitally important for your own sake and sanity, but as also for the ongoing health of your child and your family. Talk to your doctor, your pediatrician about which medications are compatible with breast and chest feeding, and there are a whole slew of them. Would be careful about over-the-counter medications. Again, a lot of them are okay to continue or use periodically, but check with your pediatrician as well on that.
So the last question is sort of who is your village at this time, right? And so who are the folks, we talked about a pediatrician, who are the people you might lean on if you're having challenges breastfeeding, if baby isn't gaining weight the way you'd expect, like who should you go to? So one is pediatrician, and before you also, or in addition to reaching out to your pediatrician, if you have a doula, great. A lot of them are also IBCLCs. Otherwise, you also might have access to an IBCLC, so a lactation consultant to give you a lot of advice. You don't necessarily have to see them in person. A lot of them are available via phone, via text, via video consult. And then the OBGYN. Oftentimes the OBGYN may not be able to answer every single one of your questions, but they have staff members who are well-versed in this area and whom you should also consult as issues and questions arise. Absolutely. So lean on your care team, the baby's doctor, pediatrician, your OBGYN, your doula if you have one, lactation specialist or feeding specialist. And again, if you have Progyny, you have a PCA who can help and access to feeding support 24/7, which is great. I love breastfeeding talking with you.
I thought you were going to say, I love breastfeeding with you. No, I love discussing this incredibly important topic, and I also like how you opened up and how we're actually continuously emphasizing this is a healthy option and choice, well endorsed by the American College of OBGYN and the American Pediatric Association, and at the same time recognize and do not feel guilty if you opt out of this. There are many other ways. Well, there's formula as well, and I can say that for sure I'm formula fed. They seem to be doing okay so far, so no guilt here.
Agreed. And breast cancer survivors, other people don't have that option. So it is a wonderful option for those who can and want to. And I hope we got rid of some of the mystifying questions around breastfeeding and chest feeding. As always, I love DocTalking with you.
And I love DocTalking with you.
And I love DocTalking for you. As always, if you have questions about anything we have talked about or any topics you want us to DocTalk about, drop them in our chat. We love DocTalking with each other and for
and with you.
Yes. Thanks. Bye.